The National Institute of Neurological Disorders defines autism spectrum disorder, ASD, as a group of complex neurodevelopment disorders characterized by repetitive and characteristic patterns of behavior and difficulties with social communication and interaction. The symptoms are present from early childhood and affect daily functioning. The word spectrum is used to indicate the multiple symptoms associated with autism and the levels of ability the person has in order to function in everyday life. Some individuals can be high functioning and their symptoms almost undetectable, and there are others who must have assistance to carry out simple day-to-day activities. Shown here is a graphical depiction of the autism disorder spectrum. Autism was first identified in the U.S. in 1943 by Kanner, who labeled the characteristics associated with autism as a developmental disorder. Kanner described 11 children, 8 boys and 3 girls, with different individual actions labeled as extreme autistic aloneness. Early signs of the syndrome included the inability to engage in anticipatory actions, the inability to convey meaning in a social sense, and the use of repeated personal pronouns rather than grammatically correct pronouns. However, most of the children had good cognitive skills and outstanding rote memory skills. Kanner's description identified 3 common symptoms, including impaired social interaction, lack of imaginative play, and lack of verbal communication. In her thesis, Full Inclusion in Autism, Lindsay van der Wiel states, coined by Swiss psychiatrist Eugene Bleuler, autism comes from the Greek word autos, meaning self, and refers to an extreme social withdrawal, signifying an isolated self. Some indicators of autism are common and easily recognizable, while others are more difficult to recognize, especially in younger children. Avoiding eye contact, interacting with only specific people, not understanding body language or simple tone of voice commands are just a few common indicators of ASD. Once again, symptoms are varied and broad. Younger children with ASD may struggle with gestures such as waving goodbye or waving hello, or blowing kisses. Repetitive behaviors are a common early indicator of ASD. A child may line their toys up by color or size. This is not a one-time event. This would occur with most activities involving multiple manipulatives. The child pictured here is lining his toy trucks up by color and size. Some other examples of symptoms in ASD would be a characteristic sing-song or robot-type voice, struggling to understand point of view or predicting others' actions, long-term, obsessive interest in certain things such as numbers, colors, facts, etc., overly or less sensitive to certain sensory stimuli such as textures in food or clothing, noises, or light. On a positive side of ASD, you will find that a person with ASD can be extremely intelligent. Many autistic people are strong visual and auditory learners, remembering for long periods of time information they have seen or heard. Many people with ASD excel in the arts such as music and creativity, as well as math and science. Stephen Wiltshire is an acclaimed autistic visual artist who paints cityscapes. He was nonverbal at a young age and at a time when the specifics of ASD were first being fleshed out. His family sent him to a special school in order that he might learn to read and speak. His first words were paper and pen, spoken at kindergarten age. He began communicating through his cityscapes and has since earned the title of human camera. Temple Grandin is another famous person with ASD. She is a leading animal scientist who also teaches at Colorado State University. She was nonverbal until the age of 3½ years of age. Her parents advocated and made provision for their daughter to be educated and taught as a person who simply learns differently than others. Doctors thought she should be institutionalized, but not because of her parent, but because her parents did not agree, she could attend public school and be mainstreamed into a normal kindergarten class. Her early interests were electronics, animals, and model rockets. She is the designer of the squeeze machine, used in more than half of the facilities where cattle are handled in the U.S. today. Diagnosing ASD can begin at an early age, with speech and language development being the most common early concerns among parents. Following closely would be restrictive/repetitive behavior patterns and socio-emotional communication. Most families with an ASD member report first concerns prior to the age of 6 years. The Journal of Autism and Developmental Disorders indicates findings that the average time interval between age at first concern and age at diagnosis was 8 months for children diagnosed early and 28 months for children diagnosed later. Some simple steps parents can do to monitor their child's developmental progress would be to monitor their child's development milestones and keep in mind every delay doesn't indicate a problem. Prolonged and multiple delays can indicate a concern. Parents should talk with the child's pediatrician if a concern does arise. A doctor is more likely to take the parent's concerns seriously if the parent has been keeping a good developmental milestone record. Don't wait till the last minute and panic. Parents should monitor simple behaviors in their children, such as: does my child make eye contact? Does my child respond to his or her name? Does my child follow objects visually as I point things out? Does my child point and wave goodbye or use other gestures to communicate? Does my child make noises to get my attention? Does my child imitate or respond to cuddling or reach to be picked up? Does my child imitate or mimic my movements or facial expressions? Does my child play with other people? Does my child show concern if I hurt myself or experience pain? As reported in the International Journal of Disability, the apparently increasing prevalence of ASD plus the behavioral fractionalization of the ASD phenotype support the move from generalized intervention models to individualized treatment processes that are clearly and tightly based upon the specific behavioral profile of the child with ASD, rather than the generalizations that might be based upon diagnostic criteria but which do not easily translate to the kinds of hands-on interventions with individual children that have been shown to produce the greatest improvement in behavior, mood, and success of children with ASD. Behavioral modification will be a first approach of as ASD diagnosis and treatment progress. Sometimes other neurological issues combine with ASD, which require other clinical and medicinal type treatment. The Individuals with Disabilities Education Improvement Act, IDEIA, begins with the assumption that to the maximum extent possible, children with disabilities should be educated with their non-disabled peers, with supplementary aids and services provided as necessary to enable them to succeed in that setting. Parents and teachers will work together to develop a well-defined and thorough IEP. Teachers' attitudes toward autism are critical. Teachers are one of the important moderating variables that may influence the effectiveness of any autism intervention. Van Weel ends her article in Full Inclusion in Autism. In conclusion, this researcher holds to the idea that despite the educational placement chosen and the intervention strategies utilized, keeping the needs of the child foremost is of greatest importance. Full inclusion should be used as often and in as many situations as possible, but it should not be forced at the expense of the child. Never should happiness or appropriateness be sacrificed under the guise of normality. In summary, it is the hope of the ASD community that teachers and family members will learn to use best practices in working with ASD students. Some of the training modifications would be to reduce sensory overload, keep a regular daily schedule, prepare student for changes or interruptions, use visuals more than words, no open-ended questions, work directly with individual students teaching social skills. These are just a few of the management behaviors that will allow a student with ASD to flourish in the classroom.